We have been getting pregnancy questions in for you because you're a fertility specialist. So let's start with Jerry. Can pregnancy cause my gums to swell and bleed? Is there any kind of connection between the two?
Absolutely.
What is it?
So, you know, the pregnancy hormones that make everybody kind of crazy and bloated and moody and tired and sad and angry all at the same time?
Yeah.
So those are the same hormones that are also affecting your gums. And you double to triple your blood volume in pregnancy, so there's a lot of extra blood flow going to places. The risk is, though, that you may develop gingivitis. So women in pregnancy have to take very good care of their mouths because if bacteria gets in there, you may develop periodontitis. And then that's a problem. So it's very important to have good mouth health in pregnancy because of this predisposition. So if you notice a little bit of bleeding is normal. If you're having a lot of bleeding, that's not normal. If you're having foul smelling mouth, that's also not normal. And it's especially important for women if you have morning sickness and you're doing a lot of vomiting and nausea and vomiting in pregnancy, that after you do, if you do vomit unfortunately, that you should rinse out your mouth, have a little toothbrush to keep it all clean because you don't want the bacteria building up there, or chew a piece of gum. Make sure everything is sanitary. Keep that your mouth's safe and sound.
There isn't anything you can't do at the dentist when you're pregnant, right? Except I guess for the x-rays. Can you do x-rays still?
Well, they'll shield you and they'll ask you if you're pregnant. The less is always more in pregnancy, right? So you don't want to expose yourself unless you must. It's the first trimester that's really the worrisome time because that's organogenesis. So as all of the organs are forming, that's where you really don't want x-ray exposure.
And that's called organogenesis.
As the organs are being generated.
That makes sense. I like it. It just sounds fancy.
I know,
love
fancy
it.
word.
Okay, this is Zahira. She says, I have hemorrhoids after the birth of my baby. Will it go away eventually? Is that pretty normal?
It's pretty common to have hemorrhoids. Do they always go away? No. There are varying types of hemorrhoids. There are hemorrhoids that are internal that bleed, and there are hemorrhoids that are external that can also bleed. The external types of hemorrhoids can be reduced most often after you've had the reason you get the hemorrhoids is because there's pelvic congestion. So the head, the body is sitting in your uterus is preventing the venous return back to your heart. So not only do your legs retain water and fluid and swelling in your legs, it'll also happen in your bum, unfortunately, in those vessels that are at risk. So some women after pregnancy gets totally fine. On other women, the hemorrhoids don't reduce. And if that's the situation, they can burn, they can bleed, they can be uncomfortable. You use the things that you can get over the counter. Sometimes your doctor will give you a little bit of a steroid cream or Tux pads with witch hazel, some ointment that you can put on it to help. But sometimes the hemorrhoids need to eventually be removed. But that's in the exceptional circumstance. Most of the time when you get about 6 to 8 months out of the pregnancy and you're starting to lose some of that weight and you don't have as much pressure on your lower body, it gets better, but it doesn't always.
Okay,
hemorrhoids
good to know.
can be problematic. It's stuff that you don't know. Babies are so cute, but man.
I know.
Right? They come with a
devastation.
Whole,
I really need my morning coffee. This comes from Dylan, but we're trying to conceive. Is there a safe amount of caffeine I can have?
Yes. So 1 cup of coffee per day. 1 cup of a caffeinated beverage. So that includes things like Sprite, tea. Green tea has caffeine. People forget that green tea has caffeine.
You have to get the decaffeinated
You have to get
kind.
the decaffeinated green tea. Why? Because caffeine's a vasoconstrictor, and when you're trying to get pregnant, you want as much blood flow to your pelvis, to your ovaries, and your uterus as possible. So you don't want anything constricting your blood vessels. You want your blood vessels to flow freely. So minimize caffeine in pregnancy.
1 cup is 250 milliliters?
Milliliters, the cup of coffee that our parents used to drink, not the super duper double guzzler.
Not the small you get now.
Not the small that from 2014, the small from 1969.
Yeah, exactly. Okay, thanks. Good advice there, Marjorie.